Just under 25% of South Africa's population is vaccinated against COVID, and now there is the variant, Omicron, and an increased sense of urgency.
You can see now the numbers are very, very high because of this new variant. Let them do it, let them force people to come and vaccinate.
So I think they can come and vaccinate so they can maybe stop the variant from maybe spreading too fast.
B.1.1.529, given a new name late last week. It's now being studied in laboratories and sequenced and analysed around the world. But as of today, experts say there are more unanswered than answered questions.
We don't yet know whether Omicron is associated with more transmission, more severe disease, more risk of reinfections, or more risk of evading vaccines. Scientists at WHO and around the world are working urgently to answer these questions.
But some new preliminary data was presented in South Africa this morning, suggesting Omicron is more transmissible, but that cases are mainly mild, with most hospital admissions in the unvaccinated. Each country is taking different steps to protect itself, to the irritation of South Africa.
We call upon these countries that have imposed travel bans on our country and our other Southern African sister countries to immediately and urgently reverse their decisions and lift the bans they have imposed before any further damage is done on our economies and to the livelihoods of our people.
10 Southern African countries, however, are on the UK's red list, meaning they will have to pay to go into a quarantine hotel on arrival. At the same time, the Joint Committee on Vaccination and Immunisation, the JCVI, extended boosters to 18 to 39-year-olds and for those with severely compromised immune systems. And they've reduced the timeline for boosters from 6 to 3 months. There will also be second doses now for 12 to 15-year-olds.
The next 3 weeks are going to be weeks of scientific uncertainty, but whilst we wait for the mist to clear on what this concerning variant actually means, there is no time to delay. It's our opportunity to get ahead, and vaccine boosting is the thing we can do most easily whilst we wait for that science mist to clear.
Omicron has more than 30 mutations on the spike protein on the outside of the virus, and that allows it to enter human cells, raising the possibility of what was described as a mismatch between current vaccines and the variant.
We're making this issue a priority, and we're in discussion with vaccine manufacturers and the World Health Organization on potential modifications that may be needed for the current vaccines to be maximally effective against the new variants if required.
From 4 a.m. tomorrow, day 2 PCR tests will be reintroduced for travellers from abroad, and masks will be compulsory in shops and on public transport. In the Commons this afternoon, there was a noticeable uptake on the government benches of face coverings.
In this race between the vaccines and the virus, the new variant may have given the virus extra legs. So our strategy is to buy ourselves time and to strengthen our defences while our world-leading scientists learn more about this potential threat.
A Bristol market today, but currently being raised as the spirit of a Christmas past, specifically last year's, which was on again, off again in England. The Health Secretary has said people should plan as normal, while perhaps wisely offering no guarantees.
Well, earlier I spoke to Dr. Vicky Bailey. She is a senior researcher at the Vaccine and Infectious Diseases Analytics Research Unit at Wits University in South Africa. She's also part of Team Halo, a UN-backed initiative to fight COVID vaccine misinformation on social media. So I began by asking her if she believed the Omicron variant of the virus is much more virulent than the Delta variant.
At this point, but it's very early days, so it's very much speculative. It looks like it's not any more severe than Delta or any of the other different variants. But again, we need more information. We only detected it a handful of days ago, so we need to now follow up those cases and make sure that we aren't seeing more severe disease. So we are definitely seeing it in asymptomatic individuals, but we are seeing it to some degree in our hospitalized cases.
Because the sort of initial reports of it all were really pretty draconian, and we were really worried that something much worse was coming.
Yes, I think that's one of the big fears, is that we know that it is mutating, and now we've just got to figure out exactly how it's mutating. And one of the big fears is that it is going to get more virulent, like some of the other coronavirus species we've seen, such as MERS. So there is the potential, but at this point, it doesn't look like it should be any more severe. And potentially there might be some immune evasion, which means that we could start to see more reinfections and potentially even breakthrough infections. But once again, we just need to do the studies.
All of us are looking for ways of understanding the scale and indeed the danger of this outbreak.
It's a difficult one to say. I think the scale that we've already seen, and the fact that it is just so ongoing, every time we think that we've made a big stride towards getting on top of this, then a new variant comes out or something else happens. But at this point, we're incredibly lucky to be where we are. We have vaccines that work, that protect us against severe disease and hospitalization. If more people would go out and get vaccinated, we could potentially overcome this and get through to the other side.
What do you make of the travel bans, and is South Africa almost being punished for being honest?
I have to say that, yes, I do believe that. I think just we've seen that this variant has now been picked up in 11 countries already. I don't think it necessarily originated in South Africa. I think we just happened to detect it that much sooner due to the assays that we're using that allow us to really detect it a lot quicker. We don't have to do all the sequencing and that sort of thing. And I think it just means that we were able to detect it faster and therefore respond quicker and actually draw light to it.
How important do you think it is to vaccinate the whole world? I mean, do you think no one is safe until everyone is safe?
Most definitely. It doesn't do any good to really vaccinate one whole population when you've got an entire continent that's got no access to the vaccine, and you're going to continuously get new variants coming out. So yes, nobody's safe until the whole world is safe at this point.
How confident are you that we are absolutely on the right track with the right vaccine? How much more work needs to be done to perfect it?
I think the vaccines that we have are doing exactly what we needed them to do and what we set out in the very beginning. They protect against severe disease, they protect against hospitalization. Once we've got that severe disease under control, we can then potentially try and find another version that will prevent more of the breakthrough, very mild infections. But at this point, the vaccines are doing exactly what we need them to do.
Dr. Vicky Bailey, thank you very much indeed for talking with us. Now, in just the last few minutes, the United Nations have said early evidence shows the global risk from Omicron is very high. Victoria joins us again from the newsroom. Victoria, there's still an awful lot we simply don't know.
Well, we are being told repeatedly, especially today, that more will be known within 3 weeks, so just in time for Christmas. It is impressive, and this must be said, how quickly the world was alerted to Omicron. You heard Dr. Bailey there saying it may not have originated in South Africa, but South Africa needs to be praised for their genomic sequencing and their openness and transparency. And this is a stark contrast to other countries where there hasn't been the same level of information sharing in the past. South Africa, of course, as you also heard, is not entirely happy, of course, with this response, which was to shut down travel. Then, of course, there's the speed with which this has all happened, and this has led to this information gap, I suppose you could call it. And again, in the spirit of openness, scientists and politicians alike are holding up their hands and saying there is still much we don't know. What this has raised once again, however, is the vaccine inequalities. Now, more than 50 countries, and most of them in Africa, have missed the World Health Organization target of vaccinating 10% of their populations by September. And there was always a warning that this would allow mutations to happen. And there have been now renewed calls for more vaccines to be sent to these under-vaccinated countries with the utmost urgency.
Victoria McDonald.
Well, joining me now are Professor John Edmonds, who's a member of the government SAGE group of scientific advisors and modellers, and Professor Adam Finn, who's on the Joint Committee on Vaccination and Immunisation. Professor Adam Finn first. We've had these announcements on boosters today, but we still don't know how much use the vaccine will be against this new variant.
Yes, that's very true. That's one of the pieces of evidence we very urgently need. This can be got to an extent in the laboratory by looking at sera from people who've had the infection and had vaccination and seeing if they're capable of neutralizing this virus and preventing it from infecting human cells. So I think we'll have much more information about that within the next week or two.
So we're chucking everything at it before we have the full picture. Second, third, fourth doses, are we going to carry on boosting into perpetuity? Is that the rather depressing spectre ahead of us?
Well, I certainly hope not. Of course, you can only use the tools at your disposal at any one time, and the vaccines we have right now are quite designed for a virus that was quite different from the one we're now beginning to see. But nevertheless, it's very unlikely that the protection these vaccines induce will be completely ineffective against this new variant. And the logic behind taking this sort of preemptive step is to maximize the immunity that people have got to compensate for the possibility that the antibodies will be less efficient. So it's the only way to do that is to do it quickly.
So if Omicron is so very different from the virus we started out with, presumably then the JCVI is gearing up for potentially a whole new COVID vaccine campaign in the spring.
Well, I think all the manufacturers now are very definitely contemplating reformulating vaccines. This actually went on last year when there was a lot of concerns about the beta variant being able to evade vaccine-induced immunity. And then, of course, Delta came along and replaced beta. So people were caught a bit going in the wrong direction. So people will want to be convinced that this new variant is indeed going to be the future problem before reformulating vaccines. But nevertheless, people are already working on that and moving in that direction so that we can do what we do every year with flu vaccine, essentially adjust the vaccine to fit the virus that's causing the trouble.
Professor John Edmonds, now give us your range of scenarios that you're currently looking at as to how bad Omicron might be or not.
I think if you look at the data coming out of South Africa, you see that the cases are increasing really quite rapidly, especially in the most heavily affected province, which is Van-Tam. And that's in a situation where it's a largely immune population in South Africa, rather like our own. They've got there via different methods. Effectively, many people have been infected naturally, and about maybe 30% have been immunized, whereas we're probably the other way around. Nevertheless, you see that the virus is increasing very rapidly. Now, that's a huge concern because that does imply that the virus could increase rapidly and spread efficiently in other immune populations, including the UK.
And if cases increase rapidly, even if Omicron isn't any worse as a virus, it would still lead to a quite significant spike in hospitalizations and potentially deaths then.
Correct. Yeah, I mean, an increase in transmissibility is far more important, actually, than a similar increase in pathogenicity, because that increases exponentially. So if you have something with a higher reproduction number, that's a real problem.
So how confident are you that the booster campaign announced today will avert another devastating wave of hospitalizations and deaths?
We don't know that for sure at all. But one thing we do know, it will at least be very effective against the Delta virus, which we still are facing. And so it's going to have a beneficial impact on the virus that we're currently struggling with. And it almost certainly, as Adam's pointing out, even though the antibodies don't maybe match up exactly with this new variant, having high levels of antibodies is likely to offer some protection. And so boosting everybody is a very sensible precaution.
Given your realism about what might be ahead, I appreciate we don't know yet. SAGE has said in the past that working from home has the greatest individual impact on suppressing the virus. Is now the time for that, in your view?
well, I think you said that of the measures in Plan B, then that's probably the most effective. I think we'd be very, very unwise to rule anything out at the moment, and we ought to be prepared to click through the gears in terms of the interventions as very rapidly if that's necessary.
But given we're not going to really know how bad Omicron is for another couple of weeks, would you advocate moving through those gears before we know?
Look, that's a political decision. People have to weigh that against, the cost of some of these measures, of course, and doing it just before Christmas would be quite costly, I'm sure. But yeah, if you just take a simple epidemiological view and never raise your eyes above that, then of course it's better to implement measures as rapidly as possible. But in the real world, we can't necessarily do that.
And given, as you say, a big increase in cases, increase in hospitalisations, that will put pressure on the NHS. We're going to be quite lucky, aren't we, to avoid a Christmas lockdown in one of the scenarios you've painted? Well,
I mean, look, this is a very, very serious, turn for the worse. There's no question about that. It's still early days, so we have to, evaluate things as they go along. But the early indications look very poor.
Professor Adam Finn, just to you finally, why not, given that, fairly depressing picture we've heard from Professor John Edmonds there, why not move faster to looking at vaccinating 5 to 11-year-olds now, given that, they will spread it even if they're not ill with the virus?
Well, all the way through this program, the priority is age, and the youngest children are probably the least, happily, the least affected by this virus themselves. And although you're quite right that they can transmit to each other and to adults, it's really the adults that do most of the transmitting. So the priority at the moment, you can't do everything at once. The priority at the moment has to be towards people at the highest risk, and to the adult population more broadly. At the moment, we don't actually have an authorized vaccine in this country for children under the age of 12 in any case. So I think it would be probably unwise in a way to move forward with that until that comes through, although June Rain this afternoon did promise that would be done expeditiously by MHRA. So that becomes a possibility in the future. But for now, I think we really do need to focus our resources, our vaccines, our people, on getting these boosters into the adult population.
Professor Adam Finn and Professor John Edmonds, thank you both very much for joining us